The correct answer for this question is option A, Pemphigus vulgaris. So 25-year-old fragile blisters which are rupturing very easily point out towards a intraepidermal blistering disorder, because subepidermal blisters are going to have very tense bullous lesions which are very difficult to be ruptured. So fragile term will not be mentioned for those conditions. So option C and option D, dermatitis herpetiformis and bullous pemphigoid, both are subepidermal blistering disorder, so we can rule them out. So we are left out with two Pemphigus, Pemphigus vulgaris and Pemphigus foliaceous. Remember students, Pemphigus foliaceous is going to involve the desmoglein 1, which is expressed in the superficial epidermis. So the patients are mainly going to present with scaling, crusting and superficial erosions instead of the intact blisters. So that is the reason why the Pemphigus vulgaris is the best option to select here, which can present with fragile blisters which can rupture easily and which can form erosions. So why is it not dermatitis herpetiformis? In the question, the examiner will also mention the gluten sensitivity and the celiac disease association, and the lesions are very itchy and they will be grouped papillovesicular lesions on the extensor surfaces. Why is it not bullous pemphigoid? Because the patients are going to be primarily elderly and also they can have itchy, tense blisters.